can somebody have a balanced hormone intervention so that non-binary people can be in the middle of a hormone milieu? So really the question is, is it safe to take testosterone and estrogen together so that people will have kind of half and half, or 30-70 or 60-40 or 40-60? Can we use both? And really the answer is that we don't know. There's not enough research. We haven't done enough studies on non-binary people who wish to have both hormones. We understand that hormones are important. We understand the function of estrogen, we understand the function of testosterone, and we understand the effects that those two hormones have on people. But what we don't really know well enough is using them together as medicines to create a balance in the middle. What do we know though? So, for example, people who have polycystic ovary syndrome, they may well have an estrogen-progesterone predominance in their hormone cycle, but they also have higher levels of testosterone. So we know that it's quite safe. There are people who have natural variation of different levels of estrogen, progesterone, testosterone in their bodies, but we don't know what effects it has medically to introduce those. But however, having said that, we do know that hormones are very bioidentical. They are very safe. They're not chemicals. They are just simply replacing hormones that someone's body would have produced. So if a non-binary person or an agender person wanted to try a small dose of testosterone, for example, to see what effect that might have on them, or to try a small dose of estrogen to see how that affects them physiologically or psychologically, then theoretically there is no risk or no danger in doing that. And indeed, we do know that, for example, people who've gone through the ovarian menopause, when we replace their hormones, to get that balance of estrogen and progesterone and testosterone right, can really help people feel much better. So we know hormones are really important. We know that they have a big effect on the body and on the mind and the psychology, and getting the right hormone profile for an individual person is really important. And there is no harm, theoretically, in experimenting and getting different levels of different hormones to see what suits. Having said that, again, obviously if you introduce something like testosterone, there is the chance that masculinization will take place in terms of facial hair growth or bone structure changes or deepening of the voice, and some of those effects are going to be irreversible. And in the same way with estrogen, obviously some of the effects of estrogen, such as breast growth or fat redistribution, are going to be irreversible. So have a really deep chat with your patient, find out what it is that they would like and what they are trying to achieve. Go slow, measure levels, and always see what the effects are going to be.